afternoon, everybody. Welcome to our afternoon press briefing. I am here today with my fellow commissioners, Ken Lawrence and Joe Gale, as well as Dr. Alvin Wong, our regional EMS director. So we have yet another level of social distancing and being practiced today. I want to thank NBC, ABC, CBS, and Fox for signing an agreement for a shared feed. So we now only have one television camera here in our Emergency Operations Center, and we really appreciate everyone coming together to do that. It protects the safety of everybody. We continue to have a very rapidly evolving situation here in Montgomery County, and as always, I will do my best to answer all of your questions. I may not have all the information available to do so, but I will do my best. Since our March 17th press conference, at the direction of the Pennsylvania Department of Health, we are moving to a community spread model in our case tracking. Therefore, I will no longer be reporting contact tracing or presumed route of exposure for each individual as I have done on all prior days. I want to emphasize that this shift is not unexpected and is consistent with the progression of a highly communicable disease like COVID-19. Since yesterday, we have had 8 new positive cases of COVID-19 in Montgomery County, which brings our total to 42. I also want to note that we have been instructed to no longer use the word presumptive, so we will simply be referring to these cases as positive. The first is an adult male, 51 years old, who resides in Lower Pottsgrove Township. This individual is currently hospitalized. The second is an adult male, 67, who resides in Lower Providence Township, whose symptoms do not require hospitalization and is currently at home being monitored. The third is an adult female, 46, who resides in Lower Marion Township, whose symptoms do not require hospitalization, and she is currently at home being monitored. The fourth is an adult male, 59 years old, who resides in Montgomery Township. This individual is currently hospitalized. The fifth is an adult female, 44 years old, who resides in Perkiomen Township, whose symptoms do not require hospitalization and is currently at home being monitored. The sixth is an adult female, 57, who resides in Lower Marion Township, whose symptoms do not require hospitalization and is currently at home being monitored. I have, unfortunately, another pediatric patient. This is a male who is 1 year old, who resides in Royersford Borough. This child is currently hospitalized. And finally, an adult male, 35 years old, who resides in Springfield Township, whose symptoms do not require hospitalization and is currently at home being monitored. I'm going to give you quarantine numbers. This will be the last day that I do that, since we will not be doing the extensive contact tracing that we've done previously. So just to recap, on Friday, March 13th, we had 229 people in quarantine. On Monday, March 16th, we had 416 individuals in quarantine. On Tuesday, March 17th, we had 471 individuals in quarantine. And as of this morning, we had 512 individuals in quarantine here in Montgomery County. Now, along with our kind of push toward more of a community spread model, I have a new set of guidelines on how long people need to remain in isolation or quarantine at home after becoming positive from the coronavirus. I'm going to do my best to walk you through this. We have made a chart. The chart will be up on all of the county's social media feeds, Facebook, Twitter, and Instagram. It is a little complicated, so bear with me. I'm going to try to walk you through it, and when I'm done, you can feel free to ask questions if it's not clear. So, we start in the middle, right here. So, that says, today you have a positive test. We're going to call you Person A. Person A should first self-quarantine, and Person A should also notify the members of their household, and we are asking Person A to also notify any people that they have had a lot of direct contact with in the last, in the days prior to them becoming symptomatic, maybe for the first, day two or three before they became symptomatic. Now, going up over here to the right side of this chart. Person A should self-quarantine, as I mentioned. Person A can exit their self-isolation when the following parameters are met. Day 0 is the day that they started to experience symptoms. Day 0 plus 7 days is when they can start to consider leaving isolation, but only if they have not had a fever for 72 hours and they're not taking any medications to bring that fever down. So just naturally, they've not had a fever for 72 hours and their respiratory symptoms, such as a cough, is improving. It does not have to be gone, but it should be better than it was. So just to recap, person A, our positive individual, can end self-isolation, or we're calling that the release day, once they are day 0 plus at least 7 days. Day 0 is the day they started having symptoms, and they've not had a fever for 72 hours without medications, and their respiratory symptoms are improved. So that's the positive person. Now let's move down to their household. So once person A becomes positive, they should tell the members of their household should self-quarantine. And their household release day they have to start a 7-day count. But that 7 days does not start until person A reaches their release date. So the household's release date is person A's release date plus 7 more days, and they've not had any symptoms or had a fever for at least 72 hours. I hope that is somewhat clear. So we can talk through this some more at the end if you have questions. All right, I want to give you some updates on the county's operations. We have limited county and court operations available today. The list of available services can be found on our montcopa.org website by clicking the red service alert button that is at the top of the page. And this list will be updated as needed. Our Montgomery County Commissioners meeting will go ahead as scheduled for tomorrow, Thursday, March 19th at 10 a.m., but it will look a little different. Due to the need to practice social distancing, seating in our boardroom will be severely limited to comply with CDC recommendations for no more than 10 people in a room. So therefore, the agenda comment and public comment periods will occur together at the beginning of the meeting. So we will release, if we haven't already, our agenda for tomorrow via social media. If an individual member of the public wishes to comment on any agenda item or just make general public comment, that will be done at the beginning of the meeting, pretty much one at a time, depending upon how many people wish to give comment, and you'll be escorted in and out. Once you get to the building, you'll be shown what to do. You may also submit a comment without attending the meeting. We will accept comments until 4 p.m. tomorrow. And you can email those comments to commissioners with an S, commissioners@montcopa.org. And they will be included in the minutes. All public visitors who wish to attend our meeting in person will undergo an entry protocol in the lobby of 1 Montgomery Plaza. That protocol will include a temperature check. If you have a temperature above 100.4, you will be denied entry into the building. As usual, our meeting will be live streamed at www.montcopa.org, and a video recording of the meeting, as always, is available on our website, usually at the beginning of the following week after the meeting. All right, I have some updates on testing. As we've communicated over the past several days, There has not been widespread access to testing for COVID-19 in Montgomery County. We've been working closely with our local, state, and federal partners to fill this gap and increase testing availability. In preparation, we have been working with our partners to establish a drive-through testing location in Upper Dublin Township. We will be releasing additional details as soon as they are confirmed. Once opened, the county has a list of critical workforce personnel, including first responders, that will be tested first. I want to emphasize the site will not be open today. We are so grateful to Upper Dublin Township and Temple University Ambler for their assistance with our efforts to mitigate this public health emergency in Montgomery County. Now, we know many of you are at home, which reminds me to remind you that if you've received your census form, this would be a great time to fill it out. You can do it online, or you can do it by phone. I cannot think of a better reason for why you need to fill out your census form than the situation that we find ourselves in right now. The money that is flowing to us from federal sources and state sources depends greatly on the number of people that are counted in the census every 10 years. And our funding from all sorts of health services like Medicare, Medicaid, veteran services, the list goes on and on. That funding will, for the next decade, will depend upon how well we count ourselves here in Montgomery County this time. So while you're at home, look for that census form. It should be in most people's mailbox by the end of the week. You can call on the phone or you can go online to complete it. And we really urge people to get that done. Just want to make a couple more comments again about mental health. We had a lot of very positive responses and people who were very grateful that we made the statement yesterday that it's okay to not be okay. It's okay to not be okay. This is an unprecedented time that we are going through. There's many changes in every one of our schedules, and it's perfectly normal to feel unsettled during this time. So treat your own self like you would treat a good friend. Make some plans. Try to carve out some time to talk with friends or family by phone or by means of the internet, and bring up the fact that you're feeling unsettled. I'm sure the person on whoever you're talking to is going to say, oh, I'm so glad you said that. I feel the same way. I also want to remind folks that if your feelings are starting to feel uncontrollable at all, the Montgomery County Mobile Crisis Unit is available 24/7. They can be reached by calling 855-634-4673. And we urge you not to hesitate to call them. They are amazing people with wonderful services. All right, with that, I'm going to turn over first to Commissioner Lawrence, who's going to give you several updates, SEPTA, what's going on in voter services, and some additional information about access to drug and alcohol services. And then Commissioner Gale is going to do an update on some public safety issues, particularly around personal protective equipment. So with that, I will turn over to Commissioner Lawrence.
All right, good afternoon, everyone. I have a couple of quick updates, but once again, I want to thank our community who is rallying to help those. This is hard for all of us, but we know that it's harder for some than most. So we continue to have volunteer opportunities on our website for people who want to help out. I do want to announce that PP&L has followed with the rest of our utilities and will not cut off service to any customer for unpaid bills until further notice. They'll reconnect service for any customers who were disconnected recently, and they will continue to disconnect service as requested by customers who are moving or when necessary for safety reasons. SEPTA. We've had questions about SEPTA. SEPTA is running. SEPTA is critical, though we are urging people to stay home. Some people cannot stay home. Many of those people are healthcare workers who need to get there. So SEPTA is running during the COVID-19 crisis. They are operating a reduced weekday regional rail service until further notice. And you can go to www.septa.org for any updates on those services. At this point in time, drug and alcohol services are still being delivered in Montgomery County. with some modifications in service delivery for outpatient services, which are employing telehealth methods for level of care assessments to enter treatment and actual treatment services with individuals. Our three main drug and alcohol inpatient detox and rehab providers in the county, Eagleville, Valley Forge Medical Center, and the Malvern Institute are also operational. The Montgomery County Community Recovery Center in Norristown is not open for person-to-person contact. However, individuals in substance use recovery that want to connect with a certified recovery specialist should call 1-800-221-6333. And there are also virtual, online, Alcohol Anonymous and Narcotics Anonymous websites out on our HHS website where you can go for a virtual meeting. Our voter services office is open, but not for in-person visits. They will take phone calls and emails. Online registration and ballot application is up and running. If you cannot register or apply for mail-in voting online, they will send you a mailed application. But we are encouraging all voters who are able to register or apply to vote by mail at www.votespa.com. With that, I'll turn it over to Commissioner Gale.
Thank you. Good afternoon. We have received many questions about the availability of N95 masks and other personal protective equipment. N95 masks, I realize some of you watching may believe that's a obtruse, large-size gas mask style mask. That's actually a small facial mask that covers the mouth and nasal passage. That's what we are referring to when we say N95 mask. And as a result of the collective efforts of county, state, and federal government, Montgomery County will be receiving more N95 masks from the Strategic National Stockpile. The Department of Public Safety's first mission is to provide support to first responder community, EMS, fire, and police. Emergency medical service agencies generally depend heavily on donations from the community and their local municipalities to be able to answer the call, and they are on the very front lines of response to this public health emergency. Just today we were on a conference call with a committee to head a foundation of charities for our region. Accordingly, they remain the first priority of our Department of Public Safety. Unmet hospital and health system needs go through the Hospital Association of Pennsylvania, which has a formal process arranged at various government levels to receive additional materials. So some of these materials could be N95 masks, ventilators, personnel, and other needs that the hospitals and healthcare industry may need. Public personal protective equipment in general remains in very short supply throughout the region, the Commonwealth of Pennsylvania, and likely nationwide. We are prioritizing requests to quickly help those who have the greatest need and those without other established pathways for resupply of this equipment. So we want to make sure that our first responders and people in the healthcare industry have what they need, and we're making sure they get it. I'll turn it back to Commissioner Arthur.
All right, thank you both, and I'm happy to take the questions.
What is the difference between the testing site in Upper Dublin versus the testing sites that hospitals have set up?
So for the most part, it is my, oh, I'm sorry. The question is, what is the difference between the site that the county will be opening up in the near future and the sites that hospitals themselves are opening up?
The ones that are currently running, I believe.
Yeah, there's a couple, 2-3 hospitals that have drive-through sites or testing in their parking lots. It's my understanding that with some rare exceptions, those hospitals are only testing patients that are already in their hospital system. So you have to be a patient of a doctor or a provider, nurse practitioner that's in that system already. They have done some, we've worked with them very collaboratively. They've certainly helped us with some first responder testing and things like that, high priority individuals. But I believe for the most part, they're only seeing patients in their systems.
And just to be clear, when this site opens up, that's not open yet, it's going to be an invitation only, and you have specific people you want to get in there first.
We do not have all of the details finalized for the site that we're going to be opening up here in the county. As soon as we have those details, we will share them with the public. What I will tell you is that when the first day, or maybe 2 days that it's open, we're going to be using this site to test a number of individuals who are critical workforce here in the county, such as first responders and others. And we will, with plenty of notice, get instructions out for what will come after that.
The Lieutenant Governor retweeted my tweet about moving to a community spread model and said that Montgomery County is the first county in the state of Pennsylvania to do this. And you said it's not an unexpected step, but it is a major step. Can you kind of explain, what that means?
Would you like, is there a question that you would like me to repeat specifically?
Well, I guess just this is a major step, and kind of what does it mean as far as?
So I'm going to paraphrase the question too. Going to community spread is certainly a change in what we've been doing, and what does that change mean for our community? Is that fair? Okay. So as I said earlier, we're moving away from a process where once somebody got a positive test, they would get a call from a member of our Office of Public Health. That call will still happen, and that would trigger this process that we talked about earlier. But previously, we would then spend quite a bit of time on the phone with that individual and try to get from them everything that they could remember about where they had been, who they had been in contact with, from the day they started having symptoms, and we would usually try to get them to remember 1 or 2 days before that if they could. And then we would call each of those individuals and tell them that they were direct contact of someone who had tested positive for the coronavirus. And then we would ask those individuals to go into quarantine. So this is how we've ended up with now over 500 people in quarantine as of this morning. So what is new is anyone who tests positive, as soon as our Office of Public Health is notified, we will let that person know. And remember, and I think I spoke about this yesterday, that many of the hospitals in particular are sending tests out to commercial labs. We're finding that it's taking 4 to 6 days to get those results back. And those results then have to be reported to the Pennsylvania Department of Health, and then they report them to us. So the process has gotten a little bit slower. What the difference is that we will not be doing that contact tracing any longer, because we're at a point, there's enough positive cases in the community, we have enough people in quarantine, and we have enough cases now, I think we're at 5 or 6, I'm not exactly sure, that we cannot trace back where they got their exposure to the coronavirus, that we are assuming that there is community spread, meaning that you might get it just from normal activity. So that is why we have been talking about the critical importance of these mitigation measures and staying home.
The cases that we're hearing about today, and I know you can't say anything definitively, obviously, but you just mentioned 4 to 6 days. Do you guys have an idea how far back they are, how far back that testing was?
I don't have that information in front of me. The health department has that information. We could get that. I just don't have it in front of me.
Okay.
I'm hearing about patients at a outpatient surgical facility being notified that a doctor there in Limerick tested positive. A number of hospitals are canceling those elective procedures. What do you say to people that may be going into medical facilities at this point to ease their fears? I know you can't comment specifically on that patient, even if he's a resident of Montgomery County, but what do we do to protect ourselves in those facilities?
So the question is, if you have elective surgery, should you go? Those types of things, right? So it would be my advice to call ahead if you do have elective surgery scheduled. Call your surgeon and find out what is going on at that particular facility. Many of our facilities are canceling elective surgery, not because somebody there tested positive, but because they're trying to preserve their bed space. They want to make sure, even with the outpatient surgery centers, they may pull nurses or other staff to the main hospital that surgery center is associated with. So there is a lot of elective surgery that's being canceled, but the reasons for that could be varied. So if someone has something scheduled, if you haven't heard from your surgeon or the hospital yet, I would call ahead and not necessarily assume that was still going to happen. And obviously, if you feel more comfortable canceling, you should do that.
Do we have any good news about recoveries yet, or is that just something that you are not tracking?
We don't receive that, yeah, we just don't have it.
We don't know how any of our
No,
people are doing.
We don't, but I will confirm that I have not been told that there's been any fatalities among patients in Montgomery County.
Can I ask a question about, we've talked over the last couple of days and last week maybe also about enforcing this sort of countywide isolation as much as possible for people. And you indicated the county's ready to enforce that if you see people in the dining room. Have you had to do any of that? Have there been any cases so far that you're aware of?
We have not actually, so let me repeat the question. So I mentioned yesterday that when Governor Wolf issued the order that prohibited dining in restaurants, and let me just clarify because it's very important, we want people to know, we don't want the kitchens to close if the restaurant can keep them open. We want people to get takeout or delivery, or if there's a drive-through situation, that's fine too, because people need to eat and it's important that they have different sources of food available to them. But what is prohibited is coming together into a dining room and sitting down at the table with a menu and ordering dinner. So Montgomery County is prepared to go to court to issue an order for any Montgomery County restaurant who's violating the dine-in rule to shut down the dine-in portion of their restaurant. We will not close the kitchen. That's not our plan.
And what county agencies would be responsible hypothetically?
That is through our Office of Public Health.
The 1-year-old that's hospitalized, is that because of the age, or is it, do you not know?
So I was asked about the 1-year-old who's hospitalized, and we certainly wish him the best. I don't have any other information other than that he is hospitalized.
Can I ask a question about the jail population? We've talked about contingency plans for the jail. Any updates regarding what's going on there?
So the question was about our jail population and
Any
if we
releases or?
have any updates on that. So I will tell you that, as we reported the other day, the President Judge issued an order to our magisterial district justices to order the least restrictive measures for anyone who's been accused of a crime. We are ensuring that for most crimes, inability to pay a cash bail would not, during this emergency, put you into the correctional facility. We would monitor in some different way. And they have, I know, taken a look at the correctional facility to see if there's anybody who is eligible to be discharged from the correctional facility as long as, all the appropriate legal guidelines are met. And I believe there have been some, but I don't have a number on that. We are being very, very careful and working very closely with the medical provider at the facility, which is called Prime Care. And they have a number of very stringent protocols in place for people entering the prison. There are no more visits, for instance, at the prison. So they've initiated a number of very appropriate policies, and I'm very happy to tell you that, as far as I know, at least as of a few hours ago, there's been no reported positives in the Montgomery County Correctional Facility, and we certainly hope it stays that way.
One more question on testing, understanding it's still a fluid situation. Philadelphia announced earlier at their news briefing that their testing facility at Citizens Bank Park would be free of charge. You mentioned that the other facilities are affiliated with health networks, and we've heard about insurance covering that. This facility, the county is setting up with the state and the federal government. Would people be paying there? Would that be insurance billed, or how does that work?
I don't have that information today, but we will absolutely release that when we release the guidance for the facility. I do want to remind people, though, that every insurance carrier in the state has eliminated co-pays for COVID-19 testing. So as long as anyone has any type of insurance, they don't have to worry about even having to make a copay on that.
If the contact tracing isn't being done now, how important is testing?
Well, so the question was, if we're not doing contact tracing, how important is the testing? So that's a very good question, and I've been talking about that over the last several days. That for the vast majority of people whose symptoms are mild and who are basically otherwise healthy people, if you feel that you can manage your symptoms at home, being tested is not going to change anything. So if you have a cough, if you have a fever above 100.4, any difficulty breathing, you should just stay home. You should just assume that you're positive and self-isolate at home. Get your household to self-quarantine. Let any, real close contacts know that you're having these symptoms. But because there's no specific treatment for COVID-19, knowing that you're positive or not is not going to change anything. You can still take a medication to reduce your fever if you want to, or maybe something to soothe your cough, but nothing's going to change. Now, if you have more serious symptoms, or you have serious underlying medical conditions, or you're immunocompromised, or you're in the elderly population, then you should call your doctor and then take it from there. And obviously, as I said many, many times, if you have life-threatening symptoms, just call 911. Our first responders are well-trained for this. They do have personal protective equipment. They will respond appropriately and get you to a hospital if your symptoms are life-threatening.
And so to make that crystal clear, are you saying there's no need to get tested? Are you saying that people, and I don't want to put words in your mouth, but shouldn't bother getting tested? Would you go that far to just say, just don't
So
bother?
the question is, should someone even bother getting tested? Right now, the priority in a time of scarce resources for being tested is going to be individuals who are in our critical workforce, who, if we can determine that they are negative and if they're asymptomatic, we can get them back to work. So that would include police, paramedics, individuals that work in very mission critical jobs, our hospital workers. We talked about the grocery store workers and the people that are on the supply chain behind those grocery stores and our pharmacies. So that's our top priority. And we want to test them because we want to know if we can get them back to work. For the average person, it's not that important that you be tested. But if you're someone who falls into one of those higher risk categories, the elderly, immunocompromised, multiple underlying diseases, then there is value in being tested, because if you have the flu, there's treatment for the flu, right? And that's still happening a lot. There's still flu in our area, and there's a lot of people experiencing symptoms of allergies as we start to see some of our beautiful trees come into bloom now. So there's value, particularly for those individuals, to get tested, because they may actually have something for which there's treatment. And it would be important to differentiate the flu from COVID-19. But for that average, basically healthy person who is self-isolating at home and feeling, maybe not great, but okay, being tested isn't going to change anything. And if you can just sit tight and take a deep breath, and I know it's incredibly frustrating because any of us, I think, would want to know for sure. But in this time of scarce resources, if you are able to sit tight and make a test available for someone who really needs to be tested, that is something that you're doing for our whole community, and you can really help be part of the solution here.
And obviously, your focus is Montgomery County, but is that specific to Montgomery County? Should people in other counties still be testing, and is contact tracing still happening there? And I apologize for asking you that question because,
So I'm being asked if that guidance and this shift to the community spread model applies just to Montgomery County or to any other county. I'm aware that, at least as of right now, that applies just to Montgomery County. We are, as I said earlier, at 42 cases, which is quite a bit more than others. So at this point, we're the place with most cases. We continue to be the place with the most cases. And as far as I know, the only place is definitely seeing evidence of community spread. So I can't speak for any of the other counties. Okay, well, thank you, everybody. And we will be here tomorrow at 3.